What can the student do to help them to achieve on clinical, is that the student and I both need to have an excellent communication. So they need to tell me when they're having problems or when they don't understand something. And I need to be communicating with them so that I can pick up when that's happening. What I really like them to do, and what I try to get them to do, is to come each day with a goal that they want to achieve. So that they are goal or outcome driven, and that they can discuss that goal with their RN and also with me, so that RNs love to have a student who knows what they want to do. And usually students do much better if that's the way they do it. So motivation, willingness to engage with patients and the RNs and the ward environment, and to be goal-centred, to know what they want to do.
I'd expect students to have reviewed the subject content, be aware of what their specific learning objectives are. On the wards, you're not going to be necessarily allocated the ward related to your subject, and you're also going to be presented with a whole lot of learning opportunities. I think take as many as you can, but focus on what your subject content is and making the most of practicing the skills that you need to practice. I would expect that you do have some basic understanding of the principles of the skills that you're attending and what your objectives are. My role, the reason I'm on clinical is to help the students as much as possible. And in order for me to help them the best, I need them to be open with me, to let me know what their learning needs are, to let me know when they're challenged by things. I guess don't be scared of me. I will come around and I may ask you questions and I may hang around, but I'm there to support, and I'm not there to intimidate you or make you feel uncomfortable. And whether I like that or not, students always feel stressed when I'm around, but that's not my intention. I'm there to help. So please, and I'm learning all the time as well, and I hope that we can learn together on clinical, and that you would feel comfortable with me being able to ask me questions to make sure you get the most out of the placement that you can.